Which of the following drugs is classified as a dissociative anesthetic? A. Propofol. B. Diazepam. C. Ketamine. D. Isoflurane. Answer, C. Ketamine is a dissociative anesthetic that causes catalepsy and is commonly used in combination with other sedatives. What is the main function of the nephron in the kidney? A. Absorb nutrients from digested food. B. Produce bile. C. Filter blood and form urine. D. Regulate body temperature. Answer, C. Nephrons are the functional units of the kidney, responsible for filtering blood and producing urine. A hematocrit tube spun in a centrifuge separates into layers. The bottom layer contains A. Plasma. B. White blood cells. C. Red blood cells. D. Platelets. Answer, C. Red blood cells are denser and settle at the bottom after centrifugation. What is the antidote for xylazine toxicity in small animals? A. Naloxone. B. Atopamazole. C. Yohimbine. D. Flumazenol. Answer, C. Yohimbine is an alpha-2 antagonist that reverses the effects of xylazine. In which species is atropine not effective due to the presence of atropinase? A. Dogs. B. Rabbits. C. Cats. D. Horses. Answer, B. Rabbits have high levels of atropinase, making atropine less effective. Which parasite is diagnosed using the Bearman technique? A. Ancylostoma. B. Strongyloides. C. Tennocephalides. D. Toxocera. Answer, B. The Bearman technique is used to isolate larvae of Strongyloides and other lungworms. What is the primary concern when using chlorhexidine near the ears of an animal? A. Burns the skin. B. Causes staining. C. Ototoxicity. D. Promotes bacterial growth. Answer, C. Chlorhexidine can be ototoxic if introduced into the middle or inner ear. Which radiographic view is best for evaluating hip dysplasia? A. Lateral thorax. B. VD extended pelvis. C. DV skull. D. Craniocaudal femur. Answer, B. DD extended pelvis view allows for accurate assessment of femoral head positioning. What is the most common site for venipuncture in cats? A. Cephalic vein. B. Lateral saphenous vein. C. Jugular vein. D. Medial saphenous vein. Answer, D. The medial saphenous vein is often used in cats due to ease of restraint and access. Which opioid is a full noroceptor agonist? A. Butorphanol. B. Buprenorphine. C. Fentanyl. D. Nalbuphine. Answer, C. Fentanyl is a full mu agonist and provides strong analgesic effects. Which fluid type is considered isotonic and commonly used for rehydration? A. 0.9% NaCl. B. 5% dextrose. C. 7.2% NaCl. D. Sterile water. Answer, A. Normal saline, 0.9% NaCl, is isotonic and appropriate for rehydration. Which hormone is released from the anterior pituitary and stimulates the thyroid gland? A. ACTH. B. TSH. C. LH. D. ADH. Answer, B. TSH, thyroid stimulating hormone, prompts the thyroid to produce T3 and T4. What is the recommended fasting time for an adult dog before general anesthesia? A. 2 hours. B. 4 hours. C. 6 to 12 hours. D. 24 hours. Answer, C. Adult dogs are typically fasted for 6 to 12 hours to reduce the risk of aspiration. A packed cell volume, PCV, of 20% indicates A. Normal range. B. Leukocytosis. C. Anemia. D. Dehydration. Answer, C. A low PCV suggests anemia, as there are fewer red blood cells in circulation. What is the most appropriate site for intramuscular injection in the dog? A. Carotid artery. B. Triceps. C. Epaxial muscles. D. Biceps femoris. Answer, C. The epaxial muscles along the lumbar spine are a common and safe IM injection site. Which instrument is used to grasp and hold tissue with minimal trauma? A. Alice tissue forceps. B. Babcock forceps. C. Kelly hemostats. D. Rochester Carmalt. Answer, B. Babcock forceps are designed to hold delicate tissue atraumatically. What is the maximum time a tourniquet should remain in place during a blood draw? A. 15 seconds. B. 30 seconds. C. 1 minute. D. 5 minutes. Answer, C. Prolonged tourniquet use may lead to hemoconcentration or tissue damage. Which bacteria is commonly associated with pyoderma in dogs? A. Streptococcus equi. B. Pseudomonas aeruginosa. C. Staphylococcus pseudointermedius. D. Escherichia coli. Answer, C. Staphylococcus pseudointermedius is a major cause of skin infections in dogs. What structure must be avoided during jugular venipuncture in cats? A. Trachea. B. Carotid artery. C. Brachial plexus. D. Lymph nodes. Answer, B. The carotid artery lies close to the jugular and must be avoided during venipuncture. What is the normal heart rate range for a healthy adult dog? A. 60 to 100 bpm. B. 80 to 160 bpm. C. 100 to 180 bpm. D. 180 to 220 bpm. Answer, B. The typical heart rate in adult dogs is 80 to 160 beats per minute. What is the primary concern when using nitrous oxide in veterinary anesthesia? A. Respiratory depression. B. Liver toxicity. C. Oxygen displacement. D. Nephrotoxicity. Answer, C. Nitrous oxide can displace oxygen, risking hypoxia if not properly administered. What is the term for difficulty breathing? A. Dyspnea. B. Apnea. C. Hyperpnea. D. Eupnea. Answer, A. Dyspnea refers to labored or difficult breathing. Which of the following is a zoonotic parasite? A. Isospora. B. Toxocora canis. C. Giardia lamblia. D. Taenia pisciformis. Answer, B. Toxocora canis can be transmitted to humans, causing visceral larva migrans. A sterile field has been contaminated if A. The corners are turned outward. B. A non-sterile object touches it. C. The pack is wrapped in blue. D. It is placed on a mayo stand. Answer, B. Contact with a non-sterile object renders the sterile field contaminated. What is the correct order for the stages of wound healing? A. Maturation, inflammation, proliferation. B. Inflammation, proliferation, maturation. C. Inflammation, maturation, proliferation. D. Proliferation, inflammation, maturation. Answer, B. Wound healing proceeds through inflammation, proliferation, and maturation. Which device is used to measure blood pressure in animals? A. Thermometer. B. Sphygmomanometer. C. Otoscope. D. Capnometer. Answer, B. A sphygmomanometer, often with a Doppler, is used for measuring BP in veterinary patients. What color tube is used for collecting serum? A. Lavender top. B. Green top. C. Red top. D. Blue top. Answer, C. Red top tubes contain no anticoagulants and are used to collect serum after clotting. What is a common side effect of dexmedetomidine? A. Tachycardia. B. Hypertension followed by bradycardia. C. Hyperthermia. D. Increased GI motility. Answer, B. Dexmedetomidine often causes a biphasic cardiovascular response, initial hypertension then bradycardia. What is the purpose of a Michel clip in veterinary surgery? A. To clamp vessels. B. To hold muscle open. C. To close skin incisions. D. To retract tissue. Answer, C. Michel clips are used as an alternative to sutures for skin closure. Which anticoagulant is found in the lavender top tube? A. EDTA. B. Heparin. C. Sodium citrate. D. Oxalate. Answer, A. EDTA is the anticoagulant used in lavender top tubes for hematology.